The pandemic has caused staffing shortages for not just schools and businesses, but also for Honolulu's emergency medical services.
Joining us live is Honolulu Emergency Services Department Director, Dr. Jim Ireland, and you're one of the busiest, hardworking employees in the city. Thank you so much for making this time to be with us.
You know, I don't work as hard as our paramedics and dispatchers and lifeguards, but I'm trying to keep up with them. Pandemic has been very challenging, but actually the folks in my department are the hardest working employees in the city.
The mayor said during his press conference, and you're very humble, the mayor said during his press conference this week that you're actually helping to fill in on shifts. So how is this latest surge affecting the staffing at EMS?
Yeah, you know, I haven't had to do that in a week or so. I don't think I'll need to do that anymore. We have 18 graduates from our EMT Academy now on the road and getting, finishing their evaluations. We have some paramedic school graduates who are in kind of the same boat. So we have about just under 30 people starting with us now that we didn't have, 2 weeks ago. So we're in really good shape. But a couple weeks ago, when I did pull a couple of shifts, one on New Year's Eve, we were short, and most of it because of COVID. And fortunately, we didn't have a lot of people, super ill with COVID, but just like a lot of other people, even our vaccinated personnel did get Omicron, and it put them out for a period of time. And so at one point we had somewhere around 20 to 25 paramedics, EMTs, and dispatchers out, and that was definitely a strain. But I'm hopeful that's behind us now.
Well, it's good to hear that you're just about back to full staffing, but this pandemic is just dragged on. We're almost into our third year now. How fatigued are the workers right now?
You know, I'll never forget January 2 years ago, and I wasn't with the city. I was actually at the airport, at the DOT, and we talked about this strange new virus from Wuhan, China, and that we were going to do everything we could to keep it out of Hawaii, and we were watching for it, and really exploded kind of before our eyes all over the world, obviously. And it's been different. In the beginning of the pandemic, I think healthcare workers, including paramedics and frontline, nurses and doctors, were very worried for themselves that they would get this disease and take it home to their families and that could, kill family members as well as themselves. And we learned of lots of healthcare workers in the mainland who were affected, and some passed away. We've had some healthcare workers pass away here. I have a doctor friend who passed away from COVID that he probably caught taking care of patients before the vaccine. So I think pre-vaccine, there was a lot of concern, both in EMS and in healthcare, how to stay safe, how to wear the PPE. And EMS was very fortunate. We had one full-time and one part-time worker who were infected kind of pre-vaccine era. They did not get that sick, and we were very, very fortunate. And we'd taken care of hundreds and hundreds of known COVID patients and many more that were unknown. And the teams, the paramedics did just great. And, the call would start with our dispatchers. They would get information. Have you traveled? Do you have a fever? Are you coughing? So they could actually give pre-arrival instructions to the fire department or EMS responding that they really needed to suit up and be really careful. So we were very fortunate in the beginning. Then we went through this lull where, there weren't tourists here, the economy was shut down, there weren't very many cases, and I think people breathed a sigh of relief. And we had plenty of PPE at that point. The chiefs that were there kind of before I came back to the city did a really good job, and the deputy director of ordering the necessary supplies we needed. And so we were in a good spot. And then, we had this next kind of spike with the Delta, and unfortunately saw some deaths there. And this was after vaccinations were available. And then now lately with the Omicron, and looking at the data in South Africa, Omicron spiked up really fast, and then it went away really fast. And so I'm very hopeful that Hawaii sees a similar go away really fast downslope of the curve. And I'm thinking we're there, almost there, but we're not quite there. And so again, everybody in EMS is working very hard. I'm very proud of everyone, but we're not quite out of the woods yet.
Yeah, but what I was wondering, just like the nurses who have gotten so fatigued, working all these long shifts, a lot of burnout, are your workers going through that same type of experience?
Well, they are working very, very hard. I call them superhuman, but they're still human. And, fortunately for a lot of the nurses around the island, the ERs and the hospitals, they get reinforcements from FEMA and mainland nurses. No such thing for EMS, because EMS is taxed all across the country. So there's no help coming for them. And they know that. And they know they have to buckle down themselves and take care of the city and county of Honolulu. And they're doing that. We have people working a lot of overtime, and we appreciate that. We have our part-timers working more shifts. So the team is really stepping up, but they have to be fatigued. You know, there's some ambulances that are in a 12-hour shift running 20 calls, and that's just unheard of. So it's a heroic effort, but we all are very, very hopeful that we get out of this soon.
The dispatchers. So what has the 911 call load been like lately, and what kind of message do you have to the public who might be calling 911?
You know, we went from 250 to 280 calls up to about 350 calls a day, sometimes over 400. So the call volume's up by 20 to 40% more per day, and we only have a certain number of 911 emergency dispatchers. But they're there to help people. They will find out the information to get the information to the crews responding. They'll give pre-arrival instructions to family members on what to do for their loved ones while they're waiting for the ambulance. So they do a fantastic job. We really, appreciate when people call for emergencies only, but we understand the definition of emergency is different with different people. But we are unfortunately getting calls for people who want a COVID test, or have very, very, very small complaints, like toe pain, or I want a sandwich, and that's not common. But reserving 911 for emergencies does help make sure that the dispatchers can get their ambulances to the scenes in a timely manner and don't have to wait. For the most part, I think people don't abuse the 911 system. And again, we're there for everybody. But with all these calls, it is challenging.
As you were mentioning, some people call 911 when they don't really need to. What are some criteria that you ask the public to remember before you do call 911?
If you think you need 911, you shouldn't hesitate to call. That's the first thing. We wouldn't want somebody to not think they need it or not sure. We'll still send the ambulance. But once the ambulance gets there, they do offer the person the option of going to the hospital or not. And sometimes if folks are not critically injured or not really sick, and they feel like maybe they could take a car or go see their private doctor, that's always an option. But if you call 911, we will come, and we will, the paramedics will do an assessment and offer the patient's transport to the hospital. Because some things you can only diagnose with x-rays and lab tests and CAT scans, and we don't carry all that stuff on the ambulance. So we really want to be reserved for emergencies, but we're going to take care of anybody who calls.
Okay, we're going to have to leave it there, but thank you so much for your time, and thank you again for your hard work as well. That was EMS Director Jim Ireland.